Journalist Mandeep Punia, arrested at Singhu, is sent to 14 days custody. His bail application to be heard on Monday. Prime Minister Modi says the nation was saddened by the insult to the tricolour on Republic Day. In his first radio address of 2021, he also praised India's vaccination program. Make Rahul Gandhi Congress chief again, says the Congress's Delhi unit in a resolution. And a day after personally welcoming 5 former members of the Trinamool into the BJP, the Home Minister, while addressing a rally in Howrah via video conferencing, says Mamata Banerjee will be left all alone to face the assembly election. VK Sasikala, expelled AIADMK close aide of the late Tamil Nadu Chief Minister Jayalalitha, is discharged from hospital in Bengaluru. Her jail term had ended a few days ago. Good evening, you're watching NDTV. Let's get you the top story at this hour. Delhi court has sent the freelance journalist Mandeep Punia, who was arrested on charges of causing assault, injury and obstruction to security forces at the Singhu border on Saturday evening, to 14 days judicial custody. His bail application will be heard tomorrow. Mandeep Punia is a freelancer with the Caravan. He was on an assignment to cover the ongoing farmers' protest at Singhu, and according to the report, he was moving through barricades and he was picked up by a group of policemen forcibly, along with another journalist, Dharmender Singh. And since his detention, senior journalists and journalist groups have taken to Twitter demanding his immediate release and criticizing the ever-increasing threat to the free media, especially to freelance journalists.
Free press. Free press. Free press. Free press. Free press. Free press.
Arrested journalist Mandeep Punia raising free press slogans while being taken to Tihar jail in Delhi after being sent for 14 days to judicial custody by a magistrate. Mandeep Punia, a freelance journalist, was detained on Saturday evening from Singhu on the Delhi-Haryana border along with Dharmender Singh while covering the farmers' agitation. While Dharmender was released after giving a signed undertaking, Punia was arrested and kept at Samaipur Badli police station for the night. The police have filed an FIR against Punia under charges of obstructing public servant in discharge of public functions, voluntarily causing hurt to deter public servant from his duty, and assault or criminal force to deter public servant from discharge of his duty at the Singhu border. Meanwhile, Punia's wife alleges that this might be an attempt to silence journalists covering farmers' agitation.
मेरे पास एक वीडियो किसी ने मनदीप के किसी दोस्त ने भेजा. उस वीडियो में ऐसा कुछ था कि आरपीएफ और कुछ पुलिस की वर्दी में कुछ लोग थे, उसके हाथ में डंडे थे और वो लोग मनदीप को लेके जा रहे थे. अभी तक मुझे मनदीप से मिलने की कोई परमिशन मिली नहीं है.
The arrest of Punia also drew criticism from Congress leader Rahul Gandhi, who retweeted a tweet which said, "Those who fear the truth, arrest journalists." Journalists also staged a protest outside the police headquarters demanding Punia's release in the national capital. India currently ranks 142nd on the Free Press Index out of 180 countries. At a sensitive time like this, while it becomes the responsibility of the journalists to report the truth, it also becomes the responsibility of the government to protect the freedom of press. In New Delhi, with camera person Manu Nair, Amakshay Dongre, NDTV.
And in his first radio address, Mann Ki Baat, the first radio address of 2021, Prime Minister Modi has referred to the events at the Red Fort during the farmers' tractor rally on Republic Day, saying that India was saddened by an insult to the tricolour on Republic Day. This even as he praised India's vaccination drive.
इन सब के बीच दिल्ली में 26 जनवरी को तिरंगा का अपमान देख देश बहुत दुखी भी हुआ. हमें आने वाले समय को नई आशा और नवीनता से भरना है. हमने पिछले साल असाधारण संयम और साहस का परिचय दिया.
And a team of 6 forensic scientists from Gujarat examined areas in and around the ITO junction in central Delhi, one of the several spots in the national capital that witnessed violence during the farmers' tractor rally on Republic Day. The FSL, or the Forensic Science Laboratory team, will be examining the Red Fort, the scene of violence on Tuesday after a group of protesters broke off from the agreed routes to drive their tractors into the complex, climb the ramparts and raise a Sikh religious flag there. And the UP police have filed an FIR against the Wire editor Siddharth Vardarajan now over his tweet sharing a news report filed by the web portal regarding the death of a farmer during the tractor rally on Republic Day. The FIR accuses Vardarajan of making imputations, assertions prejudicial to national integration and statements conducing to public mischief. The farmer who died in Delhi was from a village in UP's Rampur, and the case has been filed now by a local resident there. The story was based on comments from the farmer's family, who alleged that he had been shot. The family also said that one of the doctors who conducted the postmortem on the body had confided in them about this. And the Delhi police, though, say that the farmer died after his tractor overturned. The doctors who conducted the postmortem later issued a signed statement denying that they spoke to the family or anyone else about the post-mortem. Meanwhile, Siddharth Vardarajan has tweeted, "What is the IPC provision for malicious prosecution? Here is the UP police indulging in it, filing an FIR against me for tweeting about what the grandfather of the farmer who was killed in the tractor parade had said on record." Meanwhile, in other news, the Congress's Delhi unit has now passed an unanimous resolution asking Rahul Gandhi to return as president of the party with immediate effect. And it's a resolution that is expected to trigger a series of similar declarations by state units of the party. And it comes just days after it was announced that a new president will be elected in June after assembly elections in several key states, including Bengal and Tamil Nadu. An expelled AIADMK leader VK Sasikala, who was released from jail recently and was under treatment at the Victoria Hospital where she's been admitted for COVID-19, has been discharged. The 66-year-old has spent 4 years in a Bengaluru jail in a corruption case. And a day after Amit Shah personally welcomed 5 former members of the Trinamool into the BJP, the Home Minister, while addressing a rally in the Howrah district via video conferencing, has said that the Bengal Chief Minister will be left all alone to face the assembly elections, which are due in a few weeks.
और राजीव बैनर्जी के नेतृत्व में कई एमएलए और ढेर सारे कलाकार और ढेर सारे पदाधिकारी जुड़ रहे हैं। ऐसा क्यों हो रहा है? इसका कारण क्या है? मैं मानता हूं कि ममता दीदी ने इसकी थोड़ी मीमांसा करने की जरूरत है। मां, माटी और मानुष का नारा अदृश्य हो गया और उसकी जगह तानाशाही, टोलबाजी और तुष्टीकरण का नारा प्रमुखता से दिखाई पड़ता है। चुनाव आते आते ममता दी अब पीछे मुड़कर देखना, आप अकेली खड़ी रह जाएगी, कोई और साथ देने वाला आपके साथ नहीं होगा।
And the coronavirus pandemic has exposed how weak India's public health sector is to handle a crisis of such a magnitude. On the eve of the budget, after the break, we're going to bring you an exclusive interview with members of the medical fraternity about what they expect from the budget tomorrow. After the break, Umar Sudhir will bring you an interview with Dr. Sangeeta Reddy. Stay tuned.
I'm going to be joined by Dr. Sangeeta Reddy, who is the Joint Managing Director of the Apollo Group of Hospitals and who just in fact gave up the chair as President of the Federation of Indian Chambers of Commerce and Industry. Good morning, Ms. Reddy, and thank you so much for joining us. The economic survey has very rightly pointed out that health crisis can lead to an economic crisis and also a social crisis. And everyone is in fact expecting health to be the center stage of the budget. And we don't have a very good record of spending hugely on budget, and we have an additional burden of vaccinations. What are the challenges that you are expecting, and what is the road ahead for the budget 2021?
So, morning, Uma. Happy to be talking to you a day before what is being called the dream budget or a once in 100 years budget. I think it's a significant point for us to note that the speed of which we implement the vaccine will be directly proportionate to the speed of the recovery of the economy. So clearly that's going to be a very important expectation of the budget, whether it is a framework which involves the private sector in giving the vaccine or in corporations in partnering to actually buy the vaccine. But as of now, the government is clearly seeming to say that they will do the entire vaccination program and use the help of private sector for implementation. But I think whichever route they choose, we've been moving strongly and steadily on treatment of the virus as well as on the vaccine. So we must stay the course. Jumping into numbers, I think last year the budget or the current allocation for healthcare is about 64,800 crores. And the estimate that for the vaccine to cover about 50% of the population, we will need anything upwards of 25 to 26,000 crores. So a 40% increase in the budget outlay is the minimum expectation I think that all of us have. In addition to that, clearly, the entire COVID scenario has highlighted the importance of having adequate healthcare facilities, of ramping up capability in rural as well as in urban India, the importance of research and how we can do more, but also I think the great opportunity that India has to lead the world, to become a medical hub for international medical services. So there's some tremendous opportunities in front of us, plus some tremendous needs. So we go into the budget with great anticipation and expectation that health will be centerfold, will be a great focus, and digital health also will be very well recognized as one of the accelerators of this positive movement towards universal healthcare.
Sangeeta, you pointed out that the speed at which we vaccinate will be directly proportional to the economic recovery. Is it now time for the government to allow private sector to in fact deal with vaccines and sell them like that, because the entire burden obviously cannot be taken up by the government? You give us figures of upwards of 25,000 crore rupees for vaccinating just half the population.
So, so clearly, Uma, first, vaccinating half the population itself is a significant and possibly near adequate milestone. Let me say that first. The second thing is that who covers the cost is one factor, but also production and distribution are two very important factors as well. I think the government's plan in terms of healthcare workers first, then frontline, like the police, and then moving on to vulnerable population is a very well thought through plan and is well entrenched in public health policy. So as that rolls out, I'm very sure that over the next 3 to 4 months, the next phase will open up, which will be to open up the vaccine, but this will be in consonance with the adequacy of the supply. So what we need to do is appropriate phasing, maintain the discipline, and of course continue to maintain the overarching data monitoring environment. I believe that the track we're on is right now, and the sooner the opening up comes, the faster the acceleration, but also it should be staged appropriately.
You've been talking about, all these milestones to be achieved of the vaccine drive itself. But right now, there is that kind of a hesitancy that we are seeing among health workers themselves. Is that something that worries you? Because the government is already talking about frontline workers in terms of maybe the police force and others starting the second phase from the 1st of February, in fact.
So Uma, this is a point. I think there has been a certain degree of hesitation, but I must also say that a large number, especially of doctors, have come forward and taken the vaccine, which clearly proves to public that the science is strong, the value of taking the vaccine is very high, and therefore I think that this hesitation and some of, some misinformation, I think it will dissipate over a while. And rather than wait, it's good to move into the next phase of enhancing the net, because after we finish the police and these kind of frontline workers, then we move into a very important phase, which is vaccinating the vulnerable public, people over 50, people with comorbidities. And, you know, all of us are ready. We're ready to reach out to our patients, to participate in the program. And I think it's very important that we keep moving ahead. Of course, you know, some of the nurses who did not take will very quickly come back into the fold. And it's not as if their names have been struck off. So they will also be allowed to come in even if they come in a few days later. This is a movement, it's a momentum, and it's continuing to pick up energy, force, and credibility.
And these reports coming in about, you know, how much will be the efficacy of these vaccines that we know them as of now against the new variants, not just UK variant, but we're talking about something coming in from Iran and of course the South Africa variant.
Yes.
Is that something that we must worry about?
Suma, we're living in a new, fast evolving and very uncertain world. So worry is one thing, but the fact is that you will be more protected with this vaccine than you are without it. So undoubtedly we should take it. While at the same time, we must continue to encourage science and doctors to keep their eyes and ears open, to keep working on what they can do for adequate protection. As of now, this is the best option we have, and we should powerfully take it. I'm also happy to hear some early reports that the current vaccine is completely capable of protecting against the UK strain that all of us were hearing about. Now, the South Africa strain is kind of very new. It's less than a week old in reporting. So it will take a few weeks again to analyze. But this is a comprehensive virus framework, and therefore multiple variants will be covered in this current vaccine. And so I reiterate once again, because it's very important for us to reach that point of, you know, 40, 50% of the population covered, adequate herd immunity, and acquire entire economy picking back up again, and also a complete prevention of unnecessary deaths. So this is, it's a public health initiative, it's a preventive health initiative, it's an economic initiative.
Yeah. One last question. The government obviously has limited resources. 40% you're speaking about, you know, the vaccines are going to take away that money. Of course, we should see that as an investment, not an expenditure.
Correct.
But the second aspect is, how do you like this money to be distributed out? And to the economic survey also spoke about some kind of a regulator that we should perhaps have in the private health sector. Perhaps that would also, would that ensure against any kind of politically expedient kind of steps that the, you know, political class is very tempted to adopt at the time of crisis like we saw during the COVID crisis?
So we have no real information on what the regulator will do, Ma. I hope that, you know, if there is a design for the regulator, it is about creating a framework for adequate public-private participation. It's about finding a way to roll out the National Digital Health Mission in an inclusive manner. It is for acceleration of universal health coverage. There will definitely be some aspects of price regulation, and I hope that good economics and the ability to think about replenishing the healthcare system is also the underlying assumptions of the health regulator. But it's early days to talk about that. Before that, I would say one of the critical aspects of this entire thing, and what I'm looking for and hoping for in this budget, is that the government will parallelly encourage public at large and society at large to invest in their own health. What we saw was people with underlying conditions, whether it's cancer, diabetes, hypertension, had the comorbidities, so to speak, had a higher sensitivity and a vulnerability to any kind of virus or any kind of illness. People must invest in their health. And therefore, our request is in this budget.
Is that?
I'm referring to insurance as well as health income tax write-offs for health expenditure related to health checks and preventive health care. The current level at 20,000 rupees is adequate to cover a family, and the recommendation we have is that this should be increased to 50,000 so that the public can very confidently spend on their own health checkups and on preventive health care. This is recommendation number 1. The second one is an extension of 3080 so that this encourages people to invest in tier 3 and tier 4 cities. This is an act which was there earlier. So this is one more recommendation for healthcare on the budget, and of course to encourage further coverage of health insurance. So these are 3, I think, important things which recognize the fact that health is everyone's responsibility.
Yeah. Okay. Thank you so much, Dr. Sangeeta Reddy, for joining us.